So here, yeah, we'll start with a very small remedy, or we'll try to complete a remedy that we had started. Opium, is it completed? No, not yet. So I'm happy at least you remember that the remedy is not yet over. Okay. Yeah. Anyway, we'll start with the conclusion of opium. Like Bahubali 1, Bahubali 2, and so Opium 1, Opium 2, and Opium chapter 3, conclusion. Okay, KGF chapter 3. Okay. Yeah, please come. So what we'll do is we'll quickly recall what was done. Okay. And if you just see here, what you had studied in the previous class, or what is your understanding of opium in the previous class, will help us build today's class. I hope I am clear. Right? So I have been insisting that whatever information you are getting in the previous class, they will be very, very useful, and they will be very, very helpful in building up the present class. So what we'll do is, we'll quickly look at what was told in the last class, and then we'll continue. So if you remember what was discussed in the last class, we spoke of two small areas. Mind, yes, very good. And we also spoke of another area, and that was the characteristic symptoms of opium. Very good. Good. I'm happy you remember. Now, quickly, what are the mental symptoms of opium? What are all the characteristic mentals? I don't want the entire, at least some 5-6, so that I feel good, I feel nice.
Extreme layer.
Okay, very good. There are great layers. They are very extroverted. So though he is sick, he says there's nothing wrong with him. Very contented, very happy. This is for you people, so that there is a continuity. Right? They are very jovial, and there is also indifference which comes up to pain, indifference to pleasure, which we saw it towards the end. Very alert.
Hyperactivity followed by dullness.
Okay, hyperactivity followed by dullness, good, it makes sense. And we also saw one more very important thing, that they are all very loud speakers. Yeah, I told you it's a drug remedy. Okay, like for example, cannabis, opium, fine, or hyoscyamus, stramonium. These are the remedies, they have a lot of energy. You see them having a lot of energy, right? Opiates, that's what happens when you take all these things. You go into a different state. Okay. So, great layers, and morally not a very nice man. Okay, want of morals is what we saw in opium. And further, we also saw another very important aspect of opium, and that is the characteristic symptom. So, what was characteristic? Want of susceptibility. We spoke this point, and I also told you, like, we have some more remedies, like sulfur, sodium, larvacillosis. So these are few remedies which are thought of for want of susceptibility. Okay, good. Then, yeah, the type of breathing, characteristic breathing we saw in opium. That was one, and then we also saw that opium has painlessness. Yes, very good. Paralysis also can be painless. Retention of urine. And where did you see paralysis in opium? Paralysis mainly of the sphincters. Paralysis of tongue. Paralysis of tongue. Okay, paralysis of tongue, and then we also saw that there is paralysis of the bladder, the rectum, the intestines. They can go into paralysis. And one more very important point. No, he said something. Yeah. So that's a very important point. You have a characteristic vomiting. I'll come to it a little later. Thank you for that. We'll get back. We'll discuss that a little later. Okay. And then I was trying to tell you about a very important point. And what was that we were trying to understand is the bed in opium. It feels very hot. Hot. Bed feels hot. So what is the opium person doing? He is searching for a cooler place. what we had in Opium. Okay. And there was very sensitive to noise. See, please keep all this in your mind, because the post-lunch session will become interesting provided you interact. And that's why we had a small discussion of what was done, and I'm sure this will definitely help you in understanding today's class much better. So two small objectives we have planned for today. One is we are looking at the particulars. And being a CBTC class, I am not typically going from 1 to 2. Okay? Whatever is important for a second year student is what I am trying to highlight. Okay? So we will be describing the important particular symptoms, and we will be concluding the class with modalities. What aggravates, what ameliorates. Okay? So two simple objectives for today, nothing big. Okay? But the beauty is arriving at particular symptoms. Now, as a material teacher teaching for so many years, one of the difficulty. Now, what is the difficult part of teaching material medica is particular symptoms. Okay? Many times students get bored. क्या सर? हर रेमेडी में सर है, हर रेमेडी में आँख है, ಎಲ್ಲ ರೆಮಿಡೀಸ್ ಅಲ್ಲೂ ಕಾನ್ಸ್ಟಿಪೇಷನ್, ಎಲ್ಲ ರೆಮಿಡೀಸ್ ಅಲ್ಲೂ ಡಯೇರಿಯಾ, ವಾಟ್ಸ್ ದಟ್? And how do we remember? And many of you are nodding your head. And this is what happens when you come to the Viva. Toughest for you and the fun moment for us. So when you come to the Viva, when we start questioning you, your fingers automatically goes over your scalp and you keep scratching. And you give a very sympathetic face, or you give a blank face, and when you question why, what is the problem, sir? Confusing. 50 remedies, sir, and all 50 remedies has head to toe, all 50 remedies has ailments, all 50 remedies has mind. We get confused, right? And this is what you say when you are in first year. When you come to third year, final year, the number of remedies also will increase. And unfortunately, the confusion also increases. More remedies, more confusion. Right? So we are also working very hard to make it as easy as possible, so that you also will not get confused. Okay? So I've been insisting that one beautiful formula, one beautiful way of remembering particulars is remembering particular symptoms. So one way of understanding particulars is remembering particulars. Okay, very good. So we have different way of looking at particulars. Voice training. So what is very important for you is we look at the ailment storm. What we call it as the characteristic. We look at the ailment storm, first point. And apart from ailments, what else we also look at? Sphere of action. So I would put sphere of action first, and then ailment storm. Good. Sphere of action, ailment storm, anything else? You also look at the characteristic symptoms. Okay, good. So what we will do is, we'll quickly run through the sphere of action. So where do you see opium predominant acting? Brain. Very good. You also saw this acting on the CNS. You saw this acting on the vagus nerve. You saw this acting on the eye. You saw this acting on the heart. GI, very good. Mucous membrane, kidneys, male genitalia, female genitalia, and these are the areas where you see opium predominantly acting. They are very small, but it's very important to understand. So the first segment is remembering the sphere of action and what exactly opium does acting on those particular areas. That is pathogenesis. So this becomes important. Second thing that you have to remember is ailments from. So what are all the ailments? Fright, fear, anger, overjoy, overexcitement, complaints in children from pride in the mother. Okay, agreed. We'll come to it. Shame, being insulted. Okay. Charcoal fumes, and of course Bad effects of allopathic drugs and lead. So all those things good, all those things are here. You see this here. Must be two things you missed. One was alcohol and second one was sun. So abuse of drugs, yeah, this is here. Abuse of drugs. Good. So these are all the elements from. So, and of course the characteristic symptoms. This, and slowly as you go further, the temperament, the diathesis, the miasm, okay, and the knowledge of anat, physiology, pathology, forensic medicine will help us understand particulars better. Okay. So this is a very important slide which can be used in many of our remedies when we are dealing with particular symptoms. Hope you have a clarity. Hope things are clear here. So to understand particulars, we need to look at all these things. We need to integrate all these things so that particulars become very, very important. So my job today will be easy provided you understand, and I am just giving you the key areas. So you will have to tell me what is possible, okay, in this particular area. Right? So are you ready? We just have a small interaction so that it will be useful. So please use all this so that the next 20-25 minutes will become interesting. And straight away talking of eye. Okay. So very good. One thing your friend immediately says is paralysis. So paralysis of what? Ocular muscles. So what was the word we used in sphere of action? I used one word, if you remember, oculobulbar or oculomotor paralysis. Okay. You saw that one, very good, paralysis. Second. So you also see a very important thing related to pupil, and that is the pupils are constricted. Pupils are constricted. So what you have to remember is pupils are, you have something else coming up in the picture. Now what is this? People sleep with eyes half closed. Okay. She is sleeping. Yeah. I'm not talking about you. I'm talking about she is sleeping, but she is sleeping with her eyes half open. Okay. Many times we have parents coming to our clinic and telling, sir, it looks like he is awake, but is deep asleep. So they sleep with eyes half open. So this is what you have in opium. Sleeping with eyes half open, oculomotor paralysis, and this is again a very important thing. What is this? Yes, very good. Ptosis. Good. Ptosis. I heard the answer right. Ptosis. The lid is drooping. The lid is going into a droopy state. We call this as ptosis. Okay, ptosis. The upper eyelid is almost closing. Ptosis. So you have ptosis, you have people sleeping with eyes half open, issues with pupil, and one more very important thing, continuing with issues of pupil. See, when light passes, what will happen to the pupil? Constrict. Okay. So here, pupil in opium is insensible to light. Okay. Meaning they are not reacting. Normally, physiologically, when you pass light as a reflex, you see the pupil constricting. So this is lost in opium. Insensibility to pupil is the symptom given in your textbooks. So pupil insensitive to light. See, I want your attention here, and what I am trying to tell you is, which are the other remedies acting on eyes? You had Vijaykrishna, Cinerea maritima, you also had ignitia, okay, you had allium shipper, and you had arsenic, etc. Now the confusion. I have come to it because it's easy for a teacher to talk about confusion. But as a student, when we were also a student, we equally had good amount of confusion. Now I hope you understand. Eye of euphrasia, do you see all these things? No. What did you predominantly saw in euphrasia? One word was inflammation. You saw conjunctivitis, you saw keratitis, fine, okay? Blepharitis and other things. And then somebody also spoke of lacrimation. Do you have all that in opium? No. Hope your confusion is clear now. So each remedy will have its own affinity. Like for example, alemsipar. What would alemsipar do acting on eye? It causes bland lacrimation. It is acting on the lacrimal gland, increasing the lacrimation. Okay. Somebody has talked of ruta here. Beautiful. I appreciate ruta. What is that you have in ruta? One word when you talk of ruta is muscles. Ciliary muscles, eye muscles, they go into weakness. So what is happening in ruta? They'll have issues with vision. They can have pain. When the eyes are getting strained, they might have pain. Do you have pain in opium? I hope you are getting a clarity. Though there are so many remedies acting on eye, each remedy has its own affinity. Opium causes pupillary problems. Opium causes drooping of the eyelids, or what we call it as ptosis. It will cause paralysis. So this is the opium affinity, which is no way closer to euphrasia, no way closer to alemsipar, or no way closer to ruta. Each remedy is different. Hope you are clear.
Yes.
Right? So moving ahead, after we are done with eye, I have just shown you the image of ear. What do you expect in opium? Huh? What do you expect in opium under ear? Okay, good, very good. Somebody is talking of otitis media. Do you see otitis media in opium? So what is it that you see? Do you see tinnitus?
Yes.
Very good, beautiful. One of your friends says, sir, opium people, they have very sensitive hearing. Yeah, now your friend uses the word hypersensitive hearing. So in opium we are not bothered about OSM, CSM and all those things. We are not worried about otalgia, pain in the ear. No, that is not our concern. What is that should come to your mind when you talk of opium is, what did I tell you when I did the sleep part of opium and the characteristic? I will come to it. A very interesting part. Yeah. So what I want you to understand is, ear of opium. Under ear of opium, you see that they are very, very sensitive to noise. Hypersensitive to noise. A remedy which comes very close here is very good. Good, beautiful. Keep it up. Very good. Keep it up. Good, keep it up. I am very happy. See, yesterday answer gottiratte, but they will be hesitant to tell. Hesitant ಮಾಡ್ಕೋಬಾರ್ದು. Good, I am happy. Naxwamika. Good. Naxwamika. So Naxwamika patient will have hypersensitiveness to noise, similar to what we have in opium. But what will happen in Naxwamika and what will happen in opium? Naxwamika will get irritated. Naxwamika will get angry. And what will happen to opium? Opium will get disturbed. Please mark the words, very important. Nax will become chichirapan, gussa. Mummy, awaaz kam kar. Fine? Reduce the volume of the TV, reduce the volume of the radio, whatever. Nax gets angry. And opium is hypersensitive. He gets disturbed. Fine? So oversensitive to noise and face of opium. I know you can contribute a lot of things related to face. What is it? Very good, wrinkled. Anything else you can think of other than wrinkled face? Okay, more than emaciated. One word, more than black. Yeah, old looking. From where did we get this old looking face? Which was already told. So what I told you is, whatever has been told, we are just trying to interpret, understand, and we are trying to apply. So when I say face, old looking face. Very good, absolutely right. Anything else in face of opium? Wrinkled, yes, agreed. It looks, yeah, okay, dull looking. More than dull, yeah, okay, it looks dull, I don't know, dull has come twice. It is so dull it has come twice. Disordered. What is it? Disorder. Now what is disorder? When somebody is intoxicated. When somebody is intoxicated, you know, opium. People also can get intoxicated with opium. So when somebody gets intoxicated, the kind of expression, the kind of face you have is what we call it as distorted appearance. Distorted appearance. Okay. Moving further, there can be twitching. There can be twitching, and this is what many of you remember. Somebody was saying black, black, black. So I mean, what is very important for you is they look old. Children look old. Okay. So old looking. So that's very important. And now we are slowly talking of the other very important part. See, these features, I don't think, though some 70 remedies are over, I don't think these features you have come across in any other remedy. Have you come across in any other remedy? Each remedy will have its own uniqueness. So this is opium. Wrinkled, old looking, okay, distorted, intoxicated, dull is what you have in opium. Fine? Okay? So moving further, what do you expect in the tongue of opium? Paralysis. See, when I say tongue of ipecac, you know, your focus will be on the coating. When I say antimptat, when I say antimonium crudum, okay, when I say bryonia, now when I say opium, you understand the seriousness? In all these remedies, the issue was more with JT, antimonium crudum, bryonia, fine, ipecac. It was more of a G thing which was getting reflected on the tongue. But here what is very important for you is the affinity of the opium on the nose. Right? Okay? And then there is paralysis of the tongue. So what happens when there is paralysis of the tongue? Speech can get affected, or even swallowing can get affected. Tongue is also black in opium. Tongue can also be black in opium. So these are the things I want you to remember under tongue of opium. Tongue is, paralyzed, difficulty in speech, difficulty in articulation. And one more image you'll have to remember here is tongue is black. Okay, tongue is black. Okay. So going further, when you talk of the JT, what do you expect on the stomach? Your friend had an answer. आप कुछ बोले थे. So he was talking of a very beautiful symptom in opium, and what was he trying to tell us? Sir, vomiting hoga. And what is the character of vomiting in opium? No, tell me remedies for vomiting. What is it? Palsita? Yetusa, very good. Asika, Palsatilla, Naxmalinga, Cocculus. Yes, very good. Cocculus remains of a small case. Okay, one of our young friend, he had come to my clinic in car, and in clinic he was feeling very, drowsy, dizzy. And I travel in car, I get this nausea and I feel sick. Okay, so one beautiful remedy is cocculus. So cocculus will have traveling sickness. Okay. Cocculus will have traveling sickness. What is the character of vomiting you have in Etusa? Milk that the child consumes will vomit in the form of and what is the character of vomiting you have in arsenicum? Arsenicum. A beautiful remedy for? Very good, louder, good. A beautiful remedy for food poisoning. Okay, you eat some decayed food, whatever, and then you start vomiting. Fine? Immediately you eat, you vomit. Especially when you are taking cold things, you vomit. मेरे को गरम चाहिए, बिसी कोड़ी. The moment it becomes cold, he starts vomiting. Arsenic has vomiting. Ipecac has vomiting. But what is the specialty of ipecac? More than nausea, not relieved by vomiting. There is more of nausea, constant nausea, whack, whack, whack. And tongue is clean. Okay. Colchicum. What is the specialty of colchicum? Curd. Yeah. In colchicum, nausea comes from smell. Sight. Yes, very good. Smell, sight. Huh?
Thinking of food.
Thinking of food. आप खाए नहीं, आप देख रहे हैं, आप सिर्फ खाने के बारे में सोच रहे हो, फिर भी आप वॉमिट कर रहे हो, मतलब you are getting that nausea. That is what you have in colchicum. Pulsatilla. When do you think pulsatilla will have vomiting? After rich food. After rich food. Okay, pastries, rich food. Pulsatilla. Now, is opium confusing from these remedies? Are those remedies confusing? Some 6-7 remedies you gave, are they confusing? No. Fine, no, please have this clarity. Confusion is what we used to use it as a lame excuse, and that is continuing. Right? So, opium has something very special. And what is the speciality you have in opium is, your friend rightly said, they vomit more of fecal matter. Why do they vomit fecal matter? Because of intestinal obstruction, which you will be studying in your third year surgery. So because of that intestinal obstruction, there is reverse peristalsis, and you see them vomiting fecal matter. Okay, fine? Vomiting fecal matter. The intestinal obstruction, this is what we saw, and we also saw that they vomit fecal matter, fecal vomiting. And opium has a very good appetite. Though he has an appetite, hungry but no desire to eat. भूख लग रहा है, भूख है, लेकिन खाने का इच्छा नहीं. Many times people come to our clinic. Fine? क्यों इच्छा नहीं is a different point. But they are hungry but no desire to eat is what you also have in opium. Okay? So moving further, any remedy that comes to mind? Huh? Very good. Cilicia. Eparsal. Staphysagra. See, the remedy second year that should come to mind is belly. So deep abdominal operations. Okay. Staphysagra is right, Cilicia is right, Heparin is right, I got nothing against it. But what I want you to remember is post-surgical ileus. You know, the intestines are not functioning properly, and this has been observed that after the patient has undergone the laparotomy or undergone the abdominal surgery, since then, you know, he has observed that the intestinal movements are not proper, the intestines are gone sluggish. Fine, you can think of opium. Okay? So it can be a viva question for you. Mention the post-surgical indication of opium. Or opium can also be, thought of in incarcerated hernia. Fine? Incarcerated hernia. Okay? Please make a note of this word. You can go back, refer your surgery books. But for today, in short, because I am telling you, I have just given you the meaning. You can look at the medical part. Fine? The pathophysiology, etc., little later. An incarcerated hernia occurs when part of the abdominal tissue or intestine becomes trapped in the hernia sac. A bulge that forms when tissue pushes through a weak spot in the abdominal wall. So opium can be a very good remedy for this particular condition. And one last thing I want you to tell you here is, like colchicum, very good, like carbohydrates, like lycopodium, like cinchona, you can have bloating, very good, flatulence, tympanic abdomen. What is it? Tympanic abdomen. So an abdomen which is filled with gas. Okay, tympanic abdomen. Now, how is opium different from other things is, this abdomen is hard. For example, when we palpate, gut lagega, the abdomen is hard. Okay, abdomen is hard, and you also have this tympanic membrane, tympanic abdomen, and you also have opium being indicated for lead colic. What is this lead colic? Colic mainly because of abuse of lead. I told you this under ailment stone. Yes, I told you this under ailment stone. Okay. Other remedies, better remedies, people made. You also have platina. alumina, plumbum, and many more remedies. Okay, lead colic, and we are still talking about the GA. The last part of GA is the rectal complaints. What are the possibilities that you expect in rectum? What are the two possible conditions? Okay, paralysis, good, agreed. Obstruction, okay. Very good. One is constipation, and you also have diarrhea. Okay. From the causative factors that I gave you, can you think what can cause diarrhea in opium? I gave you a lot of causative factors, and I told you this class is more of applying, more of integrating. Fright and joy. Fright and joy can bring on diarrhea. In brackets, you will be writing a remedy, and that remedy is coffee. Especially if it is joy. Joy. Okay. So it will help you in clearing your confusion. So diarrhea from fright, diarrhea from joy. When you are writing joy, in brackets you will have coffee. Now we also have opium as a beautiful remedy for constipation. Again, lot of remedies, starting with Bryonia, starting with Arnica, starting with A till Z. You got a lot of remedies. Arnica, Naxmamica, Bryonia, Sulfur, Aloe, Podophyllum, Silesia, Carbovage, Calcareca. Very good, lot of remedies. Good. So we will try to understand the nature of stool that you have in opium. Okay, very good. Somebody quickly said black. Good, more than black. Ball like. Hard. Ball. Chota. Goal. Okay. So what is very important for you is obstinate constipation. Okay. Very stubborn constipation. Obstinate, severe constipation, and see, I told you in the first class, if you remember, no desire for stools. Exactly opposite of why so much of time and why only one person is answering. Okay, what is there in Naxmamica? All of you are awake? Yeah. So in Naxmamica you will have exactly opposite state. What is that you have? They have ineffectual. They feel like going. They will have an urge. That is Naxmamica. No desire for stool. A better remedy or similar remedy is Bryonia. In bracket you can add Bryonia. Okay. But you know, Nux will have frequent urging. Constipation in newborn. Okay. And again, very characteristic. I know you know a better remedy. Receding stools. Silesia, good. So what is receding stool? Stool comes and they go back. They come and they go back. Not naughty, they come and they go back. Fine? Okay. Are you using the word NAU or KNOTTU? So, round, hard, black, ball-like, offensive. This is the typical characteristic stool you have in opium. Okay? So, hope this is clear. So, with this we will be concluding the GI affections of opium. We started with tongue. What was important in tongue? Paralysis. And I told you what happens because of paralysis. And then we saw on the stomach, appetite is there, hunger is there, but they don't feel like eating. And we also saw there is vomiting, and vomiting is of fecal matter. It can be MCQ question. Name the remedy which has fecal vomiting. Aconite, Bryonia, Calcareca, none of this. Don't get opium and take. Sometimes we become so excited. So none of these will be the answer. Okay. So the last part, what I want you to remember here is the paralysis part. And what we saw is the bladder muscles, the sphincters, they go into paralysis. So you can either have retention of urine or you can have involuntary urination. Retention of urine in Nursing children from fright in the mother. Somebody was telling us some fright in the mother. Mother is going through some fear or she has gone through some fright and then she is nursing the child and child will have retention of fear. Okay. Right? Retention after parturition due to paralysis of bladder. Okay. Yeah, one thing I was talking to you about in this sphere of action. What did I tell you? Acting on the urine, what will happen? The urine will become concentrated, the urine will become sedimentous, and it can also end up with a calculi. So a very good remedy for renal calculi. Okay? Renal calculi, or there can also be this renal colic, where pain radiates from the kidney. Pain is either going to the bladder or it is going down into the testicles. It is going down into the testicles. Renal colic. Okay. The last part is the sleep. Before sleep, if you want to talk about the male and female, you already know what will happen in male. Increased sexual desire followed by impotency. Female, what do you expect in female? Okay, there can be issues with plexus, agreed. But one more very important thing is abortion from fright. Threatened abortion. What is it? Threatened abortion from fright. You also have another remedy which comes very close. That is aconite. Fright. What will happen in Arnica? Good, no issues. Let's clear this confusion. What will happen in Arnica? Threatened abortion because of fall, because of an injury, because of a blow. If there is a threatened abortion, then it is Arnica. Threatened abortion from fright. Kuch dekha, dar gaye. Fir the lady has a bleeding PV and the gynecologist says there is a big risk, you might abort. Aapko bed rest lena padega. Fine. For example, you get that case and you understand that she underwent a fright and then she had a bleed. Based on the other symptoms, you can decide. Opium can be one top in such situations. Okay. So we'll come to the last part here of opium, and that is the sleep. Sleep, you all know. Sleep. What are the extremes that you see in opium?
Either not sleep.
Sleeplessness or sleepiness. So this is the extreme you see. Tumba nidde athwa niddene iralla. Both are possible. So sleep. What was the word I used in first class? Sleep overpowering. And if you remember the child who had fever, that was a very important entry point for us. The child was only sleeping. Sleep overpowering. Okay? Sleeping. So sleep overpowering can be one possibility, or you also have sleeplessness. See, even this image, coincidentally, he is also sleeping with eyes half closed. You did not realize, I also did not realize in the last class. Fine? So it's sleeping with eyes half open. Or this is wide awake. Okay? So sleeplessness, which is because of the sensitive hearing. Fine? Small sounds can disturb the sleep. For example, if you see the clock, or I also told any insect walking on the wall, or somewhere some crow is making some noise. This guy, for him it is like the crow is next to him. In his ears it is making caw, caw. Fine? But you don't see the crow. Nor the people at home are hearing the crow. But there is a crow. It is making noise somewhere far. But for him it looks very, very close. So sensitive he will be. They hear clock striking, the cock crowing, doors closing and shutting. Almost hears the flies walking on the wall. I told you under characteristic symptoms. Right? Very, very, very important. Okay. So, before I take up modalities, any quick questions? We spoke of eyes, we spoke of JD, we spoke of bladder, male, female, abdomen, which comes under J, and then of course the sleep part, very important. And last we are concluding with modalities. Opium is a hot patient. Opium is a hot patient. So what could be the probable modalities? Aggravation, warmth. Correct, Allah? So, heat, sun, emotions during and after sleep are the aggravating factors. Heat, sun, emotions during and after sleep are the aggravating factors. And the ameliorating factor is a hot patient, cold things and constant walking. Cold things and constant walking ameliorates. Okay? Fine? So, before we close, hope we have done justice. At the end of the session, you are able to describe the important characteristic particulars of opium and of course the modalities. We have dedicated 3 classes for opium and it is very important. We have tried to take up some simple comparisons, okay, and it belongs to the family Peppermint. And we also spoke of another remedy in the last class, and that was, which was the last remedy we spoke belonging to the same family? Chelidonium. Okay. So don't be only in opium zone. You should also connect what was done previously and what we are going to do in future. Okay, so with this we will be ending opium, and next class I will be starting with a brand new remedy. Okay, and that remedy will be, I have 2 remedies left, one is anacardium and the other one is calibrate. If I do those 2 for you, I am done with this term will be done. Okay, and next Friday you will be having a test on the 4 remedies I have done. So what are the 4 remedies? We had Bellis, we had Asculus, we had Chelidonium, and we had done opium. So 4 remedies, you will be having a small test for 45 minutes. So please be prepared, don't be surprised. Okay, so thank you. Any questions? Any questions before we close?